We're looking at the Hill Rom Advanta P1600 hospital bed, and the Hill Rom P1600 hospital bed is a medical bed that uses a foam mattress. This particular bed also does include a chair position, and we've got the bed right now in a chair position to show how it works. And we're just going to do a quick walkthrough, show some of the basic features and what makes this bed one of the best hospital beds ever made by Hill Rom. Now, one thing that I like about this bed, and one of the features, is that the rails tuck completely under the bed. So this is both for the upper rail and the lower rail. But that's nice because when it goes underneath the rail, it's easy for a wheelchair or for a caregiver to get some sort of transport device up along the side of the bed, Hoyer lift, and then for certain uses where you don't actually even need the rails at all, they can be completely tucked under the bed, and you can put a blanket over the top and barely even know that they're there. Now this bed has full controls on the outside rail for the caregiver. So you've got controls out here for the head up and down, bed up and down. We're going to show you another clip here in just a minute that shows the intermittent rail system, which is going to assist helping the patient get in and out of bed. And then the patient on the inside of each rail is going to have controls for their head up and down, foot up and down. If it's a hospital, you've got nurse call and other features, but the patient can easily access the controls for head and foot, and that can easily be done from the inside of each one of the rails on the bed. Now, the Hill Rom bed not only has controls on the inside and outside of the rails, but it also has what's referred to as a nurse's station. This particular bed does not have a scale built in. Some of them did come with scale. If you look at that footboard, you'll see right here, this is where they'll put the scale feature. But this folds up, and you basically have control here to lock out the motors. So if the nurse or the caregiver wants to just turn off the motors and leave it in a position for the patient, they can do that. And then they also have the ability to put the bed into a chair position, bed up and down, and also perform the Trendelenburg feature and also the reverse Trendelenburg. So this nurse's station is also a nice feature here with this particular bed, being able to access these features from the nurse's station. So we've got the Advanta bed in the chair position, and the Hill Rom Advanta bed basically has the chair position because sitting the person upright, the patient upright, is better for bodily circulation. It helps them heal faster, helps them stay healthy. And what happens in the chair position is that the head of the bed is going to go up at this angle, and then once the head of the bed goes up, the entire bed frame itself is going to lift up about 15 degrees more. And the chair position is popular for people that are going to be spending time in bed, eating in bed, watching TV. But this is a feature that the Hill Rom Advanta bed has that makes it very popular. And the chair position, once again, is a very nice feature for keeping the patient healthy and improving bodily circulation and helping them heal and recover quicker. So we've taken the Hill Rom Advanta bed out of the chair position. We have it right now in the head up position. And another feature that the bed has is a feature called auto contour. And if you look right below this section right here of the bed, you'll see that what's happening is that there's a slight bend in the legs. And the reason that it's doing that is because when the head goes up, there's a tendency to push the person forward, push them towards the footboard and push them down towards the bottom of the bed. And with an auto contour feature, what that'll do is that'll keep them in place, and when the head goes up, it'll allow them to be a little bit more comfortable, but it'll also prevent them from sliding down to the bottom of the bed. So the auto contour feature is another feature that the Hill Rom Advanta. Now, one feature that the Hill Rom Advanta P1600 bed also offers is an intermittent rail system. The rails are very easy to put down. So basically, you've got these push buttons right here. You have this one for the lower rail, and then you've got the other one here for the upper rail. And when you push those, you'll push those towards the end of the bed, and they'll drop down. Now, the bottom rail has a two-push system. So what we've done is we pushed it and set it once, and you can see that the one that's close to us right here, what we've done is use the first set of intermittent settings. And what that does is it basically opens up the center of the bed. So the patient now at this point can get into the bed and also have access to these handrails. So they can get into bed, have access to the handrails to help get themselves in and out of bed. and have that type of assistance. And so the intermittent rail system is a nice rail system. Once again, if we push this one more time down here, we can basically bring the rail all the way down. And so basically it'll come down from here. I'll set it one more time. Down, and then what we'll do is we'll push it once again flat up against this side of the bed. So the Hill Rom Advanta P1600 bed is one of the most popular beds. This is going to be used for hospitals around the United States, long-term care, home care, and international hospitals, surgery centers. And this bed, once again, is known as being a very durable and reliable medical bed. So if you're looking for a reliable med-surg bed, these are sold reconditioned, refurbished, and they are almost always in stock. So you can get more information off the internet, off our website. You can give us a call us direct for more information, and we can ship these all throughout the United States. And they're also available in our showrooms here in Virginia and also in California. So give us a call for more information on the Hill Rom Advanta P1600 hospital bed.